Hello, welcome you all. Welcome to this AK Business Solution medical coding training webinar on this beautiful Sunday night. Welcome to my Power Pack session on this medical coding webinar. So let's start our today's agenda. So our today's agenda is I am going to cover the entire picture of medical coding. So we start with the first point, that is the introduction of medical coding. The second point is the introduction to the code sets, that is CPT, ICD-CM and HIPAA code set. Third point is what is the RCM cycle, what exactly the business model of this medical coding domain. Fourth point is the salary slab in India and abroad. Fifth point is the institute trainer profile. It's my profile regarding my previous experiences. And sixth one is the CPC certificate structure. What exactly the CPC certification structure? What are the different modules that covers? Seventh point is the complete course structure. Yeah, it includes all the complete syllabus of the CPC course. The eighth point is the job opportunities in India and abroad for this medical coder profiles. Ninth point is the bonus to the students who attend this webinar and who join this medical coding training program. And the last point is the group access to medical coding jobs. That is my personal group, which include all the jobs available in this particular medical coding domain. So let's start our today's webinar. So what exactly the medical coding? So medical coding is the key step in the medical billing revenue cycle management. It's a multi-billion revenue generating industry, and in this particular domain there is a huge growth opportunities in current as well as in future as well. So right now there are lots of companies are into this particular business. The giants like Gibbs, Atos, Intel, UHG, Cognizant, Cotiviti, and there are many other companies who are in this particular domain, and there will be huge requirement of the talented people, especially the CPC certified coder is the key requirement to enter in this particular domain. So next line. So in the next line, so what is exactly the medical coding? In medical coding is nothing but the transformation of the healthcare diagnosis, procedure, medical services, and equipment into universal alphanumeric codes. So generally in United States, every patient visit needs to be documented in the form of medical record, no matter whether it is an office visit, whether it is a hospital outpatient visit, whether it is an ambulatory surgical center visit, radiology visit, or pathology visit. Irrespective of any location, all healthcare services needs to be documented properly, so that it's a mandatory in USA to document a medical record. And what is the coder responsibility after that? The medical coder who abstract the information from the documentation and assign the appropriate CPT code. CPT code is the codes which coders use for the services that is rendered by the doctor. And the second is the diagnosis codes. Diagnosis codes is the problem or the disease that is with patient. And third code set is the HIPAA code, which it means it's a healthcare common procedure coding system. This code set is used for injection, supplies, durable medical equipment. So all these code sets is used by the medical coder, and after coding of that particular medical record, coders create a CMS 1500 claim form based on the CMS guideline and insurance prospective guideline, and the biller bill that claim form to the insurance company. So this medical coding is the first key important step in the medical billing process. Without coding, this process is incomplete. So it's begin with this particular process is begin with the coding, and the medical coder job is very important in this multi-billion-dollar industry. So I'm going to tell you what are the different code sets that we use as a coder. So first code set is the CPT codes. What is CPT code? CPT means current procedure terminology. Current procedure terminology is a medical code set that is used to report medical, surgical, diagnostic procedure to entities such as a physician, health insurance company, and accreditation organization. Particularly, this CPT code is nothing but a procedure codes. The services which is provided to a patient by any doctor, it irrespective of any specialty. For example, all the services that is provided to a patient by surgeon, services to the provided to a anesthesiologist to particular patient, the particular test that is performed by the radiologist for a particular patient, certain lab tests, urine tests which is performed by the MD pathologist. There is a different for all those medical healthcare services. There is a specific code set designed by this American Medical Association. So in the CPT codes, all those code sets are documented in a book which is known as CPT book, and this course is designed by American Medical Association. So there are different code series that we use while CPT coding. The first one, 00100 to 01999, this code series is used by coder to report anesthesia services provided by the anesthesiologist. Second, 10021 to 69990 is the code set that is used to report the surgical services provided by a surgeon to a particular patient. The third one is the 70010 to 79999. It's a radiology procedure. All chest x-ray, CT scan, MRI, PET scan, nuclear medicine, all those services come under this particular codes category. The next point is pathology and laboratory procedure. So all lab tests, urine tests, blood tests, all these come under this 80047 to 89398 code series. Next is medicine services and procedures. So it's a separate section which include all the diagnostic testing based on the different organ system, and the code series is 90281 to 99607 is the code series that is used to report the medicinal diagnostic testing procedures. And the last one, which is very important, evaluation and management service, and it is identified by 99201 to 99499. In this E&M service, it includes complete healthcare different vertical. In E&M, it includes the codes which is used by doctor in office setting. It includes the codes which is used by the doctor in emergency department. It includes all the facilities like hospital inpatient, outpatient, emergency department, skilled nursing facility, home health care, and all the different healthcare facilities covered under this E&M services. So there is a huge scope of this E&M coder in this current market. And no matter, there are other specialty as well which is all equally important, but this E&M is a very booming specialty nowadays, and there are huge job opportunities in this particular specialty. All right, so next slide. In next slide, I'll just give you the clear picture about the ICD-10 CM code. What exactly this ICD-10 CM? It's nothing but ICD-10. It's a 10th version clinical modification codes diagnosis code sets. What diagnosis code set it means? It include all disease symptom, or each and every diagnosis is available in the form of codes in this ICD-10 code set books. Who developed this? This is first developed by the WHO, the World Health Organization, and approved by American Medical Association. So in this ICD-10 code, it's generally a 3 to 7 character in length. Approximately 68,000 available codes for all the disease and symptom currently. In this code structure is the first digit of the code is alpha, second and third digit is numeric, and fourth and seventh digit either alpha or numeric. So ICD-10 codes are very specific. Example is hypertension. So I-10 is the code used for the hypertension. Similarly, there are different diseases and different categories. Codes are used for the different diseases. For I-10 is for hypertension, E119 is for diabetes. There are other I-7 3.9 for peripheral vascular disease. Likewise, there are different diagnosis codes. All these codes are available in this ICD-10 CM books, which is this code set is developed by the AMA in joint venture with the WHO, World Health Organization. So this is the second code set that we use in the form of code books by every coder in the United States, in the India, in the UAE, in the Australia, all countries use this ICD-10 CM codes to report the diagnosis code. Okay, so next code set is the HIPAA codes. HIPAA codes is nothing but Healthcare Common Procedure Coding System. So Healthcare Common Procedure Coding System is a collection of code which represent procedure, supplies, product, services to a medical beneficiary or a private commercial health insurance companies. So this code set generally include durable medical equipment, for example, PAP machine, insulin injections, wheelchairs, and all the drugs injections codes is also identified by the J codes in this HIPAA code set. So all these HIPAA codes include durable DME supplies and the product injections and drugs it include in this particular code sets. So this three code set is used by a medical coder while coding the medical records irrespective of any specialties. First is the CPT code, which is used for the procedure performed on by the doctor on particular patient. Second is the HIPAA codes. Second is the diagnosis code, the problem with the patient, and the third one is the HIPAA Healthcare Common Procedure Coding System. This code is used wisely for for example, if adrenaline injection is injected to the patient, J0171 is the HIPAA code for that. There are some other procedures as well. Based on the type of procedures and type of product used, these HIPAA codes are randomly used by the coder as per the medical records. All right, so these are the three code sets that is used by the medical coder while coding a medical charts. Next point is the RCM cycle. So this is exactly the business model of US healthcare. So this is the RCM cycle. RCM is stand for Revenue Cycle Management Cycle. So all doctors, all healthcare providers, all pathologists, radiologists, chiropractic, podiatrics, optometrists, even surgeons, hospital visits, each and every provider needs their money from the insurance company, and there are the different steps that is included in this particular business model. So for the first step in this RCM cycle is the appointment scheduling and patient registration. In this step, appointments are scheduled and the patient information is entered into the practice management system. The second step is the insurance verification and eligibility. Before rendering services to the provider, the front desk office checks their insurance details, their deductible, copay amount, what are the different services that's covered under their insurance program. That step is the second step. After the eligibility verification is completed, the third step is the medical coding. Medical coding is the key step before we proceed with this RCM cycle, because after eligibility and insurance verification, doctor confirm that particular surgery or particular test is covered by patient's insurance. So doctor render the services and generate a medical record. That medical record, it comes to the coder review that medical record and assign the appropriate CPT code, diagnosis code, and HIPAA codes. After that codes enter into the practice management system, the claim form is generated, and the charge entry team or billing team enter the charges into the system and create a claim form and transmit that claim form to the insurance companies. So after claim transmission, either claim to the insurance company. Before that, the claim goes to the clearinghouse, and the clearinghouse scrub the claims properly, and as per the insurance company requirement, they transfer it to the insurance company in their standard format. Once the claim is received to the insurance company, either his claim got paid or denied. So all the paid claims, EOBs are received through a fax to the provider, and it is also downloaded. It is also downloaded through a insurance portal, and the payment posting team is the team which post all these ARA EFTs into the PMS practice management system. For all the claim which is denied, there is a separate team which is known which is called AR team, account receivable team, who checks the reasons for denial, who call insurance companies, and who get all the details from the insurance company, and if it's denial related to any billing related issue, they fix their issue there itself, and they again resubmit the claim. Or if it's related to coding, they transfer they put their comments in the denial management sheet and transfer it to the coders. Coder again recheck the codes, assign appropriate diagnosis code, and add appropriate modifier, and again that claim goes to the clearing house to the insurance company. So these are the cycles that and this entire cycle is known as the revenue cycle management. So there is another step, correspondence follow-up. It is the correspondence means any insurance not denied the claim for additional information. So insurance wants certain additional information before proceeding the payment. So like insurance wants sometime medical records, some X-ray report, lab report to just to observe to fix this reimbursement, because certain high dollar value claims required insurance needs to review thoroughly with the medical records and all before proceeding towards the payment. So that correspondence is also comes to the facts, and the coder or the ARP person based on the requirements of the insurance, they check all their requirements and provided the appropriate information, medical records to the insurance company, so that claims got paid. All right. So this entire cycle is known as the revenue cycle management. So every doctor needs their reimbursement. So in United States, almost all people are covered under any medical insurance. So there the patient no needs to pay a money from their pocket except their copay amount, which is the fixed amount that needs to be paid by the patient. All the services which is rendered by any doctor or any pathologist, radiologist, they got money from the insurance company, and to get the money from the insurance company, this cycle needs to be followed properly. So here is our coder role is very, very important, because without proper coding, doctor not get paid properly. Okay, all right. So let's begin to our next slide. So this is the current coder salary slabs. Generally in United States, New Zealand, Australia, the coder salary is around $55,000 to $85,000 USD per annum. In UAE it all Dubai, Saudi Arabia, Bahrain, Qatar, all 7 territories of UAE, the certified medical coder salaries around 96,000 AED to 12,000 AED per annum. And in India, based on the specialty, the medical coder, senior medical coder, the salary slab is around 6 to 8 lakh. For TL and assistant manager, the salary slab is around 8 to 10 lakh. For manager and above, 10 lakhs to 60 lakh. Based on their experience, the salary is more as well. So these are the salary structures for the medical coders, and there will be a huge scope in the India as well, and the abroad as well. Okay, all right. So next slide. So before I give you the clear coding, the course structure and CPC details, CPC certification details, I just want to tell you, all of you, about myself. My name is Ashish Kokre, and this is my institute, AK Business Solution. I am a CPC, CCS, and ICD-10 certified from aapc AHIMA. I am holding a 7+ years of experience in this medical coding domain. I have more than 25+ specialty experience, and sorry, currently I am working as a manager, coding and revenue cycle management, EA Inc. It's a California-based multinational company, and I'm also freelancing coder professionals for some of the companies. Regarding my previous experience, I was worked with the Data Marshall, First Insight, MedData Carefro, E4E Healthcare, EXL Services, Atos, Syntel, Gebs Healthcare Solution, etc. So this is my profile, and before we proceed towards the next slide, I want to give you the clear picture regarding this our previous slide. Whether these figures are real or not, I will tell you through my live salary details I shared to all of you. You just decide how big this career opportunity is. So let's I will show you my offer letter of my previous company. So this is my offer letter of my previous company, data marshal, and you can see. Excuse me, just 1 minute. I'm sorry. Yeah, let's continue. So this is my offer letter of my previous company before I joined my current company, EINC. My role over that company is a team lead, and this is my package. 9.33 lakhs is my package with my previous companies, Data Marshal, where I'm working as a team lead, and now I'm coding manager. So as per our slide, for team lead and assistant manager, 8 to 10 lakh slab is, and here is my offer letter, so that you're confident that yeah, this is the real figures, and you also understand that if now I'm manager, what will my current salary. But I don't want to share my current salary and current offer letter because it's a confidential information. But you all of you understand that this is the real picture of this career in this vertical medical coding domain. And apart from this my regular income, I'm also working as a freelancer with some of the companies. And here the amount of money that I received from that company, 87,500. This is the recent transactions. If you want, I show you the previous month as well. Here again, 87,500. So 87,500 I'm receiving as a freelancing coding professionals from some other company, and this is my current salary. This is an overall picture about my income through this profession. So guys, there is a huge scope in this particular domain. This is the highly skilled professional. Once you master with all the coding terminology and the guidelines, no one will stop you, and there will be huge career opportunities as a medical coder. All right, next slide. So I will give you the picture about the CPC exam. So CPC is the exam. Its a full form is Certified Medical Coder, conducted by American Academy of Professional Coding. The CPC exam, it's a 150 mark multiple choice question exam. The total duration of the exam is the 5 hours 40-minute duration. And once if you favor fees, the one free retake is allowed during 1 calendar year for those who are not clear that exam during their first attempt. And it's an open book code book exam. So this is the CPC exam structure. So what it covers, how this CPC exam are what is the syllabus of this particular exam, what are the different modules, how you need to prepare for this particular exam, that I covered in the further slide. So in this exam, the 10,000 series is the series for the CPT codes, surgical CPT code. 10 question is allocated for this 10,000 series. It includes surgical procedure performed on the integumentary systems, skin, nails, pilonidal cyst, repair, destruction, and breast. As I mentioned earlier slide, that 10,000 to 16,000 series is for surgery, 7 series is for radiology, 8 pathology, 9 series for medicine, 9 series for E&M. The same way this CPC exam is constructed. For example, the 10,000 series is then question for the 10,000 series, which is an integumentary system. 20,000 series, it is again a surgical CPT procedures code series. 10 marks is allocated to 20,000 series. It includes head, neck, back, spine, abdomen, shoulder, all the surgeries performed on those areas. Third series is the 30,000 series. It includes surgical procedure performed on the respiratory system, a surgical procedure performed on the cardiovascular system, surgical procedure performed on the hemic and lymphatic system. And so all the surgical CPT codes covered under these 3 series. 4 series, 40,000 series is the surgical procedure performed on the digestive system, lips, mouth, pharynx, esophagus, stomach, and all those organs which is come under this digestive system area. 50,000 series is the series for urinary surgical procedure codes used for the urinary system, surgical procedure performed on the male reproductive system. So 10 question is allocated for this 50,000 series. 60,000 series, again 10 questions. It includes surgical procedure performed on the nervous system. So basically 10,000 to 16,000, almost a 60 mark is allocated only for the surgical CPT codes. So the major portion of the exam is covered under this surgery CPT codes. So 60 mark is for surgical CPT, and the 90 mark is for the other syllabus. So let's begin our presentation. Yeah, so here is the evolution management. As I told you earlier, this is the one of the best specialty in this medical coding domain, where you earn a very good salary. Currently in Pune, Cotivity is the name of the company. In that company there are lots of projects on this particular specialty. So once you master with this ENM, you get the opportunity from this Cotivity company as well. So the 10 mark is allocated for this ENM specialty in the CPC exam. It includes coding for all office visit, consultation, hospital inpatient, emergency, critical care service, all the different locations, and their ENM codes are covered under this ENM coding. The next is Anaesthesia. It is again very important and very easy code series. It only 8 question is allocated to Anaesthesia. Before proceeding towards the operation, anesthesia must be given to the patient, and that all the anesthesia service performed by the anesthesiology certified registered nurse anesthetist must be documented in the form record, and that record must be converted to the proper anesthesia code. Then only that anesthesiologist and the CRIA got payment from the insurance company. So overall 8 mark is allocated in the CPC certification for this anesthesia services. Next is the radiology. All CT scan, ultrasound, mammography, nuclear medicine, PET scan, X-rays, MRI, all those procedures comes under this radiology series, which is identified by 7 series code. So 7 series codes is the radiology series, and the 10 mark is allocated in the CPC certification exam for this radiology series. Again, this is also very easy. Next is a laboratory and pathology. So 10 questions is on this lab and pathology coding. It includes all the blood tests, drug tests, panel test, urine analysis, and the molecular pathology testing. All this comes under this laboratory and pathological coding, and the 10 mark is allocated in the CPC certification exam. Next, medicine. As I told you earlier, that medicine section is the diagnostic testings involved in this code series. For example, different tests, diagnostic prospective test performed by the doctor based on whether it is a problem related to gastroenterology, whether it is related to ophthalmology, whether it is related to cardiovascular. Based on the organ system and the problem, there are certain medicine tests that is performed by the doctor before rendering the treatment or before rendering the services to the patient. So for example, though all those testing procedures comes under the medicine section, and the 10 mark is allocated for that section in the CPC certification course. Next, medical terminology. So all organ system, human body and anatomy, and the medical terminology, collectively 16 marks for these two topics. Medical terminology, it includes all the surgical procedures terminology. For example, thoracentesis. What is meant by thoracentesis? Thoracentesis means removal of fluid from the thoracic cavity. So every medical term is prepared by a combination of 3 things. First, prefix, second, suffix, and the root word. So it's a combination of collectively it is converted to a particular medical term. So for that, all those terms, 8 question on this medical terminology, which is a very easy portion, and the 8 question on anatomy. This is a very general anatomy. No pathophysiology or no any detailed anatomy is required. Just you need to understand what is the organs involved in the particular system. Let's consider, for example, it's a heart, which is a cardiovascular system. What are the different organs of heart? 4 chambers, 4 chambers of the heart, then papillary muscle and their tendinae, their superior vena cava, inferior vena cava, and all organs, which is all organs. You just need to understand the organs. What is the system and what are the different organs? For heart, these are the organs. For eye, these are the organs. For ear, these are the subcomponent of ear. For gastrointestinal, small intestine, large intestine, esophagus, stomach. You just needs to understand the different organs involved in the particular system, and the 8th question is only allocated to this organ system anatomy. The next is ICD-10 CM. 10 question on this ICD-10 CM is the diagnosis coding. So 10 question is allocated to ICD-10 guidelines and diagnosis coding. Then 5 question is for HIPAA coding. It's very easy, because a HIPAA code, it's a clear-cut coding, no guidelines involved into this HIPAA coding. For example, adrenaline injection 0.5 milligram is given. There is a specific code J0171 is for adrenaline injection. So no need to worry about while coding this HIPAA codes, because it's a clear-cut direct code. You just needs to understand what is the product used and what is the for that particular patient. That's all. So 5 question is for HIPAA coding. Then again, a coding guideline. There are the different guidelines while coding the medical charts. It's a diagnosis coding guideline. 6 question is allocated to diagnosis code, and the modifier usage. Different modifiers is used while coding the charts. The 5 to 6 questions on that particular segment. The next is compliance and regulatory. 5 questions is on compliance regulatory. For example, what is Medicare? What are the different parts of Medicare? Then what is the LCD guideline, NCD guideline? What are the NCCI edits? What is HIPAA, AB and RVU? All those compliance and regulatory related topics cover under this compliance and regulatory module, and there is a 5 questions allocated in CPC certification exam on this particular domain, on this particular segments. Next, so here is the end of today's presentation. If you have any questions, if you want more detailed information about this particular course, you can reach out to me on this. This is my WhatsApp number 8806037250, and my email ID is ashish.coding@gmail.com. So thank you so much for all of you for attending this session, and have a wonderful career ahead. And thank you. Goodbye.